everybody. April Meneghetti here. For those of you that don't know me, I am the current president for CCDEH, and I'm honored here to welcome you all to our first virtual training series. While I'm very sad that we're not able to meet in person, I am really happy that we're able to offer this virtual meeting for everybody, and I really look forward to next year when we can be together in person. It's going to be awesome. I want to start off by giving a big thank you to our sponsors. We are lucky enough to have Acela and Daryl here sponsoring us our whole technical training series. So they're in the background making sure everything runs smoothly. Also wanted to thank Hedgerow. They sponsored 3 rural county scholarships, which is great. And then I also want to say a big thank you to KHA. They sponsored quite a few retired directors as well. And before I give this over to Jeff, I did also want to just make a point to remind everybody that there's still time to submit your nominations for the Excellence in Environmental Health Award. This year, we're going to have 2 different awards, one for non-COVID and for COVID. So I know we've got a lot of great things that we're doing, and we're looking forward to seeing what you guys submit to us. And with that, I'm going to transfer this over to Jeff, who's our incoming CCDEH president and who has been the chair for this conference. So thank you all for joining, and I hope to see you all in person soon. Thanks.
Thank you, April. Jeff Lamore, incoming president for CCDEH. I want to welcome you all to the webinar training series. Going to have, look very excited about it and looking forward to our kicking off with the food session today. Just real quick for housekeeping, I want to for those that are on or attending the series, in order to get your CEUs, you need to you can go online. You can see on the page there. You'll want to complete your evaluation. Once you complete your evaluation, there will be a box there that allows you to then, you're able to download, once you've completed the evaluation, you're able to download your CEU, your certificate there. So that's available to you. So make sure you do that, and then that will allow you to get your certificate. From there, anything else to add on that one? I think we're good there. From there, I'll go ahead and do introductions. I'd like to introduce Lisa Frias. She is the LA County Director of Environmental Health. She is our Food Policy Chair. And with that, I'll turn it over to Lisa. Lisa, you're on mute.
I unmuted, sorry. So good morning, everyone, and welcome. I'm really honored and excited to present Heather Buonomo, who's the Chief of the Food and Housing Division for San Diego County, and also our new CRFSC chair. So welcome, Heather, to CRFSC. We really look forward to your leadership. And want to just turn this over to Heather so that we don't take any additional time. And she's going to be presenting on, of course, our restaurant tours and related to COVID-19. So Heather, I'm going to turn it over to you.
Okay, thank you. I'm going to share my screen and pull up the presentation. So bear with me, I'll get it off of the notes mode. Did I do it successfully? Okay. Let's see. So we'll start at the beginning. Hi, everybody. So excited to be here today. And I always believe in just starting everything with some positive vibes. So want to just take a moment to reflect on all of the positive things that have been going on, starting with CCDEH going virtual. Who thought that it would be possible? And while I'm really sad that we're not all together at a conference, in September, I think this is a great opportunity, and I think it really opens it up for a lot of people that might not have been able to attend some training sessions this year. So just kudos to the CCDEH leadership team for bringing this together. And what other positive things have we done? Let me look at my notes. We have all really been changing over to telework, which I think is huge. I've been speaking with so many other jurisdictions, and it's been a challenge, even for environmental health specialists who typically work in the field and are accustomed to not necessarily being in an office. It was a big transition, especially for a lot of leaders and managers. And we've all accomplished that as well. And as a working mother, sometimes I love it and sometimes I hate it, but we're all doing it. And so kudos to us for accomplishing that. And let's see. And I think, you know, that we've just been over the past 6 months grappling with so many changes. So I'm going to talk about a little bit of that today, but just want to, you know, kick it off and let everybody know how appreciative I am to be here and to be talking with you about these changes. And let's do it.
Heather, if you don't mind, I forgot to mention, there will be a question and answer session at the end. So if you have any questions that you'd like to pose to Heather, please put them in the Q&A section on Zoom.
Thanks, Lisa. All right, so today I'm going to go over some of the state guidelines for COVID operations at food facilities, talk about resources that are out there and available to us, and then focus in on how to utilize different communication styles and proactive, effective communication, as well as some partnership. And I should say, I don't proclaim to be an expert in any of these, but definitely want to share the information that we have so we can all learn from each other moving forward. Okay, so for state guidelines, there's several guidelines now that are applicable to what we do each day. So on-site dining was initially prohibited in March, and that limited our restaurants to takeout and delivery only. And prior to the state allowing on-site dining to resume, they said that, you know, there needed to be guidelines, and that's kind of the same procedure for all industries before they were able to open. And so the state released some guidelines on how to safely operate and conduct indoor dining. And this was really, the food was really one of the first guidelines that came out from the state, one of the first few. And since then, we now have quite a few others. Every industry has one. Some industries are coupled together. But specifically for retail food, we have 4 that are applicable today. We have dine-in guidelines, takeout guidelines, guidelines for restaurants, bars, and wineries, which encompasses breweries as well, and then some guidance for delivery services. So it's important to note that these documents are occasionally updated. And so you'll want to, and I'll say this probably a few times throughout this presentation, but you'll want to check back onto the CDPH website to make sure that you're not missing any changes or just kind of reviewing for tweaks. In looking back in preparation for this, the dine-in guidelines have not been updated since July 2nd, but the other 3 were all updated as of July 29th. The updates are not usually big, it's minor here and there, but still it's good to review them again, not just set it and forget it. So we're gonna go into a little bit more detail on these guidelines. So we've been navigating the guidelines since the beginning of May when on-site dining resumed. And I thought for a bit about how we could best spend our time today, because I know that everybody is already using these. We're already doing them. So rather than kind of robotically going through what the state guidelines are and the requirements are, I thought it'd be better to kind of spend our time just talking a little bit about some of the similarities and differences in the guidelines. And also give some tips that I feel like I've picked up along the way that I wish I would have known in the beginning when I first was reading all of these. So my first tip is to read the cover. So the actual below the date, there is a little bit of information, and some of it is the same on different guidelines, but it changes and they provide little updates. So typically that's where you'll catch the first update. So The most recent one that they've updated on the cover was just reiterating that these guidelines can only be implemented with the county health officer approval following their review of local epi data, including cases per 100,000 population, rate of test positivity, local preparedness, all of those triggers to scale back or open up. They're kind of calling these out here now. They're saying you can't just follow this guideline and be okay. You also have to do it in concurrence with your health officer. So that was a little update that was new to these. And I think that as of now, the other update as of July 13th, that is inside of these and on the CDPH website, is that as of July 13th, all counties, not just those with high rates of COVID, but all counties are required to close indoor dining operations right now. So my next tip for these guidelines would be read the purpose. So as you open up the guideline on the second page, there is a purpose. And that purpose I've really found helpful, especially as new guidelines come out or as they're adjusted, because oftentimes it'll say specifically who it pertains to. So maybe this just pertains to restaurants, or maybe the guideline pertains to restaurants, breweries, and wineries. You know, maybe it pertains to distilleries, but it calls it out in that purpose. And so that purpose is another helpful place to look. It was especially helpful. I know that many of us also regulate swimming pools and body art. And so in some of those other industry guidelines, it was really important because that's how we were kind of piecemealing where are the guidelines and the regulations for swimming pools. Oh, okay, it calls it out here in the purpose. So it's good to read that purpose as well. All right, let's see. I already mentioned that all dine-in is currently needs to be outdoors. The other important item to note right now is that breweries, wineries, and bars must be closed unless they're providing a meal. And so that meal must come as part of the same transaction as the food. And so they must be having that kind of outdoor food service if they want to remain open. And we've been doing locally down here in San Diego. We have a great relationship with our local ABC inspectors and have been communicating a lot on this. And I do know that down here they have been going out and doing some compliance checks at some of their permitted bars and breweries to make sure that that on-site meal is occurring. So in each of these guidelines, there's some standard similarities. And if you just kind of looked at the guidelines quickly, you would think they were exactly the same, but they're not. So what are those similarities? Face coverings. Face coverings need to be worn at all times when not seated at the table. So you get up from the table and people are walking around, they should have their face coverings. All food handlers need to have face coverings. So face coverings are going to be standard, and the guidance and the guidelines for face coverings is really similar. It may give some additional tips based on the business type. So for example, in delivery, it says, be sure that to wear your face covering when picking up the food or delivering the food, whereas in restaurants, it says, guests must wear their face covering at all times except when seated at their table. So there's little nuances to each of the guidelines, but they all cover face coverings. They also all have a workplace specific plan and talk about the contents of that plan. And so that plan basically is saying that each facility needs to sit down, think about how they're going to comply, and have some sort of plan written out that they're going to follow to make sure that they're going to protect themselves, their food handlers, and their customers against COVID. They all also include topics for worker safety. And so a big one of those is going to be training. And so having a plan doesn't really help at all if you're not training your staff on it and making sure that they're implementing it and following it. So training is the biggest element of topics for worker safety. It also goes into, on each of these guidelines, what training needs to be done. So everybody needs to be trained on COVID symptoms. And this is another area where the guidelines get updated. Is those symptoms are changing as we learn more and more about COVID-19. They're putting out new and different symptoms to be aware of and look for. So another good reason to look back occasionally. Also, this section on all guidelines includes what somebody needs to do if they're sick. So if they're sick, stay home. But as an employer, what are the procedures for that? Who do they call? What do they do? It also talks about hand washing, face coverings, and then making sure that all the employees are trained on that worksite plan. The other similarity is individual control measures and screenings. So this is guidance, and it's all the same in these guidelines, and it's for employers to make sure that they're screening their employees for health. They're checking symptoms, they're taking temperatures or having them, self-take their temperatures before they come in, that people are using PPE, and that the employers are posting signs for awareness for the employees and for the customers on COVID and what the COVID symptoms are. The next element that is in all of these is disinfection, cleaning and disinfection. And so this really does vary a little bit based on what the guideline is. So for something like food delivery, it's focusing on making sure that where the food is stored in the car or where it is held before the delivery driver picks it up is done so in a clean and sanitized manner. But for restaurants, that looks really different, right? It's talking about, not having self-service stations and removing any items that are commonly shared and making sure that the operators are disinfecting on a really frequent basis, all of those common touch points that customers or food handlers, employees might use as they're in that restaurant. They also include physical distancing guidelines, so saying 6 feet apart or utilizing barriers to accomplish that. And wow, have we seen some creative ways to accomplish this? There's never a dull moment in environmental health, but there's been some especially interesting moments as we watched people build barriers and hang shower curtains and try to manipulate their food facilities to stay 6 feet apart. Okay, so with each of these guidelines, they also do have some differences. And so, as I mentioned, each one of the categories that I just talked about, they'll have some operational tips and things that are specific to that type of operation. So again, while they look similar, they do all have a little bit of different information. So now that we are familiar with the guidelines, what resources are out there for us to help put some of these guidelines into action? How can we package it up into something that can be shared with your stakeholders and your operators? And where can you go when you have questions as a regulator? So the first valuable resource is the COVID-19 the California COVID-19 webpage. It has data, all the epi data that for the various jurisdictions. It has the roadmap, what are the triggers that need to be met to keep different industries open or have industries scaled back. It also has some guidance documents that they've put out there. Cal OSHA has a COVID checklist for businesses that could be used. And then this is also where you'll find all of these guidelines. Another great resource has been the Essential Services email. And so it's listed there on the left-hand side, Essential Services Inquiries at CDPH. And, as we are trying to sift through what is Cal Code and what are these guidelines, oftentimes they just don't jive. Or oftentimes, it's something that is in neither of them. And so you just need guidance on, hey, is this operation allowed? Or one that we had recently sent was, what do you define as outdoor? What does outdoor dining mean to you? Because everybody nowadays has these beautiful roll-up doors or windows that slide open to create, this great indoor-outdoor experience. But was that meeting the definition of what they meant for outdoor dining only? So we had emailed essential services, and I have to say our experience has been that they have gotten back to us typically in 1 to 3 days, which is pretty fast. I usually ping them again if I don't receive a response after 24 hours. So for the most part, they've been very responsive, but they responded and said, we define outdoor as no more than one wall. And that was really helpful because then we could go out there and apply that into the field as we're looking at different operations. We shared that information with the Restaurant Association and the Food and Beverage Association so they could work that through their members so we could all kind of be on the same page as we navigated these changes. Let's see, another great resource is your local health orders. And so each, beyond the guidelines, each jurisdiction has their own local health officer order. And it's important to be really familiar with that because that changes as well. And that's unique to your jurisdiction. So what might be required in our health order here is going to be different from Orange County or Riverside. So really important to read that. And read it in entirety. Sometimes, we just focus on the sections that pertain to us, but there's really a lot of relevant information in those health officer orders that are applicable in different ways. So read that. Those are frequently changing as well. So make it a habit to go back and make sure if you're not receiving notifications when it changes, make it a habit to go back and read that, maybe every week or every other week. But that's going to be important to make sure that you can really help your operators navigate both the state guidelines and what's happening locally. So more resources. CCDEH is going to be a great resource. They have documents that Cheryl has posted online that can be used right here. So in the beginning of, well, I think it was April because on-site dining was approved in May, beginning of May. The California Restaurant Association, CCDEH, and CRFSC all partnered and worked together to create a guidance document that is a template that could be used throughout the state. And basically it took those guidelines and it digested them into common terms that we use in our food world and with our food industry. And it made a checklist, and you can see it right here. So a checklist that was then posted at CCDH and also sent out on the forum that different jurisdictions could adopt and then tweak. You could change it and make it your own based on your local health officer order, but it kind of had all of the meat of the state guidelines so that it was easy for people to just not have to recreate that wheel and kind of hit the ground running with the document already ready to go. It was really great that we were all able to work together because the Restaurant Association was able to give feedback on, okay, well, we wouldn't really use that term, or can we tweak this because this won't work? So it was a great collaboration, and I know I've heard a lot of feedback from people that they are using it. So I'm glad to hear that that was helpful. So CCDEH has that resource. It also has other resources that jurisdictions have been creating throughout COVID. I know Sacramento's been posting and providing a lot of information on documents they've created. And everybody really, this is another kind of big kudos to this group, is that nothing like a disaster for environmental health specialists to really pull together and share resources and help each other. And all these guidance documents that have come out and are being shared on the CCDEH forum are a great example of that. I've used some from other counties, so I appreciate it as well. The disinfection guidance right here, that's another example. That example is from San Diego County, but we shared that out for people to use. So again, two good resources. Another good resource is going to be professional organizations. So who better to kind of come up and understand the industry and come up with good creative ideas than the industry themselves and the people that are doing it. So industry associations are another great resource. I've had quite a few experiences in this pandemic where, you know, my team was making a recommendation that we thought was a brilliant idea and we thought it would be easy to implement, only to learn it was a flop. So a good example of this actually is those restaurant operating procedures. We had used the template that was created and we adapted it to our local health officer order, and we shared it out with all of our operators and we posted it on our website, and we thought, man, we are on it. And then staff went to the field and started seeing them all blank, posted on the doors. It's a requirement to post in the front area here, blank. And so, you know, in asking restaurants, you know, they're kind of like, I didn't really know how to do it. And we went back to the restaurant association and said, hey, what's going on? Why isn't anybody filling these out? It was simply because we didn't provide instructions. We didn't explain that you needed to save that to your computer. It's not a fillable, it is a fillable document, but not one that automatically saves. And so people would go to print it and it would print blank and they would lose their information and be really frustrated and not go back to it. So not a very helpful tool if it doesn't work correctly. So, you know, it's just good to have those resources to reach out to and say, okay, let's think tank. I think I'll kind of pause there and go to my next resource. Press briefings. Man, has information been flying at us all really quickly. And it has been a lot to digest. So that's why these resources are so important, and I really wanted to spend some time on them. In the environmental health world, I think that we all are just the type of people that we like to read and we like to digest and we like to research and we want to understand the why. And there's no time for that in COVID. We need the information now, and information is changing and it's changing live. So for me, I think these were unexpected resources that I really had to adopt and start utilizing. So press briefings, you could see Governor Newsom above and our health officer, Dr. Wooten, below. And I, you know, made it a habit to tune into these press briefings and listen to them. I'm doing other work while I'm listening. But oftentimes, new information was coming out that greatly impacted our industry. So it became really important to tune into these. The good thing about social media is all of these briefings were live streamed on social media. So it made it really easy to kind of have it on a phone and be listening to it while doing other work. So those are a great resource. It's also a great resource to not only just tune into our world, but hear, you know, information in the briefings that are applicable to other industries and kind of where those are going and how we can learn from what's happening in other industries. Social media is also really important. So Twitter, if you don't already, start following and getting tweets from your local board. A lot of information was being put out by our board members or even Governor Newsom on their Twitter feed. And that was the quickest way to receive that information. It wasn't coming down from normal channels. There wasn't time to get the information out through emails to all different departments. And so sometimes I was learning about things straight from Twitter. So, you know, I guess these are just the new times. The news is another resource, you know, not always the most accurate resource, but the news is reporting live. They're giving live information. They're getting all these tweets. They're getting all of these other feeds, and they're putting it together and putting it out there. So the news is a good resource as well. All right, so now that we have all these resources, we have all this information, how do we get the information out to the people that need it? And how do we do that in a timely manner? And who needs it, right? On some days, it was my team, my employees that needed it. On some days, it was our stakeholders. On some days, it was food handlers. So, getting that message out, we needed to use a variety of means to get it out, because there was a lot of different facets that we were trying to take into the larger picture here and make sure that we were doing it in a timely manner. And if you find out through a press briefing or through Twitter that restaurants need to significantly modify their operations in 1 or 2 days, to no longer have indoor dining, that message needs to be out now to make sure that everybody who wasn't listening to that press briefing has time to kind of land on their feet and adjust and do it. So we used a variety of methods. And I have to say, I feel like this was one of, I'm going to talk at the end, kind of like making the lemonade out of the lemons. And I feel for me, this was another one of our lemonades. Traditionally in San Diego, we've done a lot of training and outreach, but it's always to here in our office, in our large training room. And sometimes our turnout is good and sometimes it's not. And I think that we've really polished off how to get the message out virtually and electronically and through different avenues that maybe we don't need to hold those large in-person trainings anymore that really disrupt the customer's business. So what did we do? So we worked through local associations like the Restaurant Association, our Food and Beverage Association, the Tourism Authority, the Brewers Guild. We worked together with them on sharing guidance documents, whether it was ours that we've created that we want them to share, or something they've shared that they wanted us, or something they've created that they want us to share. And we also, all those people I just mentioned, I was attending their monthly meetings, I was attending their exec team meetings, and just being somebody that they could ask questions to and giving them an update. Even if that update was going to change the next day, they were still happy to have it and really grateful to be able to ask a live person some questions. We used GovDelivery. GovDelivery is just a platform that we have. There's a lot of different ones out there, but this is how we send email messages to all of our operators. And so we have different groups for every DEH permitted facility, or maybe just our food facilities or any combination thereof. And we sent those messages out a lot. Like every time there was a new guidance document that was created, every time that guidance document was updated, when clarification was needed, maybe there was confusion, when there was a new requirement. And so since March, we've sent 37 of these GovDelivery messages out to our food operators. We also had a telebriefing where it was a live presentation that people could call in or text in or email in questions to. We were really lucky to, on one of our telebriefings, have our health officer who was able to also be there and answer questions. So that was another way to get important information out. And then we participated in Zoom's calls, Skype, Microsoft Teams, Blue Jeans, you name the app, and I've spoken on it in the past few months. Just attending and leading and doing all sorts of meetings, both internal and external. And so let's pause for a moment on talking about internally our own teams and what's good for them. And something that we also learned is we were so focused in the beginning on getting the message out to the customers about these changing rules and regulations, and we're sending emails internally, but we realized that live person-to-person contact and hearing that information from a supervisor or a manager or a chief was really important as well. And so we're doing every other week, we have an all food staff meeting that is now it's Microsoft Teams meeting, so that people can, see and hear the messages and ask questions and have those answered as well. So don't forget all of your internal partners that you need to communicate with as well and get messages out to. We use social media quite a bit as well. We have a Facebook page and an Instagram page. and a Twitter account as well. And so we were posting important messages, you know, whether it was more of a public health message about wearing face coverings or if it was links to updated guidance documents. We also reshared all of our local press briefings on social media so that our customers were seeing that. And there's no better way to watch a press briefing than after it happens, because you can fast forward a bit, or you could set it to talk a little faster and get that information even quicker. So that's another great resource and way to get the message out. And of course, we had a COVID web page stood up just specifically for our food documents. And then we would post everything there, whether it was a county document, a state document guideline, or our resources for our restaurants, the checklist. We would post those all there, and frequently in those Gov delivery messages, share out that link and remind people where it is. We also have a living Q&A. So it is a Q&A that every time we have kind of a new question pop up that we haven't been asked before but sounds really relevant, we add it to this Q&A. And then we are reminding people, hey, always check back in on the Q&A. We're updating it as we have more questions come to us or as we learn more information. We put it there, and so it's constantly being updated. And then another huge lemonade moment for us was translating documents. So we were able to translate most of our documents into the 7 most common languages in San Diego County. And this is just so important because all of this work in getting the message out and all of the work in creating documents is really useless if people can't read or understand the message that you're putting out there. And so I think moving forward, this is going to be another one of those things that we really focus on having not just, you know, English and Spanish, but having the 7 most popular languages in San Diego County translated for all of our documents. Partnership. I definitely, I'm sure you've picked up on the theme. It's been a theme that we believe in partnership, and partnership is really it's so valuable, and there's so much that we can get from partnership. So I want to first talk about fellow jurisdictions and give a big shout out and a thanks to all of those jurisdictions that I know I've been reaching out to. I get emails from, we share information, we bounce ideas off each other, not only to be consistent with each other, but really to help each other problem solve. And that's just something that I love, the camaraderie. I just love it in environmental health. And so don't be afraid to pick up the phone and reach out to fellow jurisdictions. They're our partners. Our other partners are, you know, the Restaurant Association or your local industry groups. We have a lot of neighborhood associations here. So I'm sure a lot of people are familiar with the Gas Lamp Quarter. They have their own association, and building partnerships with them has served to be so valuable. We had an incident when bars were first allowed to reopen. The Gas Lamp Quarter was kind of taken over, and police didn't know what to do. And in the heat of this moment, you know, we picked up the phone and called the president of the Gas Lamp Association, who immediately sent messages out to all of the bars and restaurants. And within several hours, the situation was changing, and we were able to kind of have boots on the ground down there, you know, at 11 p.m. at night. So you never know when you're going to need these partners, and they're really valuable. So I encourage you to figure out who are the partners in your jurisdiction that you can really work with and collaborate with on solutions on both ends. So what are the benefits of partnering, right? Because some people, it's foreign to say, oh, well, the restaurants are my partner, we're regulators. Well, yes, we're regulators, but some of the benefits of partnership are learning from each other, right? We become more successful when we better understand processes. And so we can learn from restaurants, we can learn from what they're doing, and then better educate them on how to make that safer. We can collaborate on solutions. All of us, I know all of us want restaurants to be open and operating. We want to be out there inspecting for food safety, not COVID, right? And so we need to collaborate on solutions with them to make them successful, so we're all successful. When you partner and have that approach, you build trust. And trust is one of the key factors to get better compliance. And it really goes a long way. It creates smoother enforcement. Also, when industry supports the actions that you're doing, enforcement is smoother. It creates efficiencies in getting messages out, which can create cost savings for you as a department. There's potential cost savings for sharing information and sharing documents as well. You know, if the wheel's already there, you don't need to recreate it. Utilize what's already there and reuse it. Partnering helps us better understand the business challenges, which again helps us adapt our public health messaging. I talked a little about gas lamp, knowing who to call when there's an emergency, or knowing who to call you know, when you need to get buy-in maybe from an industry partner, or when you need assistance and enforcement with a particular type of industry, knowing who to call is huge. Having a wider reach, you know, customers and leadership throughout the state. If you build partners, and this is, you know, another thing about environmental health, we build partners with each other. We have a statewide reach to know what to do, or a statewide reach to think tank and solve problems. Partnership builds openness, it builds trust, it builds honesty, and these are all key elements in gaining compliance, right? So here's my lemonade slide. So what are we gonna do as environmental health professionals to truly make lemonade out of the giant crop of 2020 lemons that we've all been served? And I don't have answers to these, and I'm not looking for answers today, but what can we build upon that we've learned this year, right? What legislation will be important in order to partner with industry to promote food safety moving forward in this new day and age? Third-party food delivery has blown up, right? So pushing forward with food safety for food deliverers, or promoting shared kitchens. There's going to be a lot of people that are out of work moving forward, and they're going to want to start their dream food business. And so how can we promote shared kitchens and shared economies, and helping disadvantaged communities be able to start some lower cost food startup businesses? How can we take what we've learned and reshape what we're doing? We're kind of already doing it with this virtual conference right now. And what changed that we like and we don't want to go back? I love, not that I've had time to enjoy it, but I love seeing all the outdoor dining. I love seeing some streets closed and people outdoors. So, you know, maybe it's time to reconsider what can be safely done outside. I always bring up limited food prep if you know me, but, you know, is it time to reconsider what limited food prep is and expand that definition? How can we partner with operators to help them, you know, do something new? How can we be the catalyst in promoting the shared economy? And can we promote that shared economy in a new way? You know, do we all have a baker that only works nights that, you know, could share a kitchen with somebody else and not need to have their own kitchen space? I think, you know, this next year is going to provide so many new opportunities for us. This last year provided a lot of challenges, and there's always challenges, but with those challenges come opportunities. So just wanted to really kind of end on that, on the opportunities that I see coming in the future, and that I really look forward to working with this dynamic team on pushing forward our profession and our industry and food safety. So with that, I will stop my screen share and I'll open it up for questions.
Okay, Heather, Tim here. We do have a few questions that have come in. Melissa asks, any idea how many hits you get by the regulated community on your social media and website? What percentage of your facilities do you think you're reaching?
So we're currently reaching, we do have all of that data. We typically have about a 97% success rate on the Gov delivery messages. The social media, we look at once a month, all of the analytics as to what was our top post and how many people are sharing it. I don't have that data with me today, but that is something that is very easy to pull and look at and analyze to see kind of who you're reaching, who's sharing it, what site they're sharing it to, how many likes you have, and of course, comments.
Great. Dottie asks, can you explain more about the Gov Delivery email? Is it an email service, or what is it? What's the cost? Is there a limit to the amount of words? How does that work?
There's no limit to the amount of words. I could certainly share back out through CCDEH the costs. I don't know those off the top of my head. It is an email messaging system. So we basically we collect all of our emails for all of our permittees, and they're uploaded into this system, and then we kind of group them. And so at any given time, we can prep this a message and put links in it, and then we send it to those particular groups. So it's an email delivery service, but it gives you the analytics, like the previous question asked, to know who it's reaching, who it's not reaching, and the success rate. So it's been hugely successful for us. And again, one of the great lemonades that we've had during this was we've received so much positive feedback from our operators. People just saying, thank you for the information. Thank you for the message. People calling to say, can I just run something by you? Or can I ask a question? I got your message. I read it and I have the following questions. So it's been really positive for us.
Cool. I have kind of an enforcement question here. Have you had any food facilities claiming constitutional protection from closing their indoor dining?
Yes, we have, and they're in compliance now.
Okay. Another question from Darwin. Do your Q&As include the answers from essential service inquiries email from the state?
Some of them do. It depends on what the question is, not verbatim. We put it into our own words, but we do provide that guidance out. The perfect example is the 3 walls, making sure that people understand that is what is outdoor dining.
Okay. Chris says, can operators update their email directly to you or to Gov Delivery, or do you get that information and then manually update the system? How do they keep their email current?
I believe we have to manually update it if there's a change. People can also sign up for it on their own. So there's 2 ways to do it. There's one method for Gov Delivery is that you can subscribe. So the entire county of San Diego uses Gov Delivery. And so there's all different groups that you can sign up for, whether it's disaster or fire alerts. So that's one way, is subscribing. But then the other way that we used it mostly for this was our own internal. So we have uploaded the operator email addresses to it, and then need to manually change it if those change.
Okay, thank you. Elizabeth asks, is there a specific number of people that can be at a shared table for dining? Is this in any of the guidance documents?
Off the top of my head, and this is could be different in your own jurisdiction, but it needs to be members of the same party or the same household is typically what we're seeing. In San Diego, we do not have a limit to that, as long as it's all members of the same party.
So, and same party does not mean necessarily same family, right?
I mean, that's a hard one to distinguish.
Yeah.
I think the intent was that it was going to be the same household, but I don't think it's quite shaken out that way.
Okay. Can bars, breweries deliver alcohol or allow for takeout alcohol at this time?
My understanding is yes. And that's a question for the ABC, right? Great thing to be partnered with your local ABC to make sure that you're up to snuff on all of those changes.
Okay. You mentioned a recent change to the industry guidance documents. Was that a local health officer needs to buy in? Can you elaborate? Do we need a local health officer order adopting the guidances?
I'm not sure I understand the question, so I'm going to try to answer it redirect me if I'm off here. So one of the updates I talked to was just on the cover of the guidelines, the state guidelines. It's calling out that you can't just follow the guideline. You can't say, oh, well, this guideline exists and I'm following it, so we're good to go. It's the guidelines plus plus the situation that's happening in your local jurisdiction, right? So whatever the current situation is, there's some counties that are on the monitoring list, some that are not. Everybody had to stop indoor dining, but then from there, there's variances. So basically the messaging on that cover, the intent is to say, this guideline is in conjunction with your current situation and health officer order.
Okay, so there may be the need for some local health officer clarification declarations to implement the guidelines.
It could be.
Okay, all right. When restaurants, so this is from Elizabeth, when restaurants are allowed to reopen, is there specific guidance on barriers that are allowed?
So meaning that when people return to indoor dining, I believe it'll return to how indoor dining was with COVID. And so that looks like having everybody 6 feet apart or having barriers to separate them.
Okay, so kind of how people were moving in the direction until things changed and only outside dining was available.
Yes.
Okay. What about, have you seen any issues with closing streets down and having outdoor dining, like any incompatibility issues with other businesses? And have you guys gotten involved in that?
We've been involved in conversations. We haven't had any issues. And largely this is going to fall to the local municipality, zoning, PD, or dealing with some of the road closures and issues that have come up resulting from that. For us, the guidance that we have provided to our cities is as they do it, is that the tables, it's not meant to take, let's say a restaurant could seat 100 people. It's not meant to be now they can seat 200. It's just meant to say, okay, take the 100 that your kitchen has the correct capacity for and put that outside. And so the other guideline that we've had is also that outside restaurant, we should be able to tell and should have a distance and a separation from the restaurant next door and their outdoor dining. And that they shouldn't have any prep stations out there. They can't have any condiment stations out there. You know, all of that needs to still stay inside. You're just moving the tables outside and you're separating them from tables with other restaurants.
Okay. Justin, I see you've joined us. Do you want to unmute yourself? And did you have any comments about what Heather said? And
of course, Heather, really on behalf of CCDEH, and I can say the Restaurant Association, we really want to thank you, not only for this presentation, but for all you've done in the early years or early months of COVID, putting together that guidance that was extremely helpful. And your work hasn't stopped. It's going to continue as we go into phase 2 and 3 and 4 and 5. And I know that the Restaurant Association is particularly keen to have us participate in a virtual health seminar to continue with some of these things. And your time and everybody, Lisa and everybody else's time is very valuable. We know it's difficult to do it, but because they are such a key player in this space, we'd like to keep that relationship going. So again, just on behalf of us all, thank you so much.
all right. Heather, I got a couple more questions that came in if you are up for it. Jamie asked, did you get involved in approving any of the outdoor dining venues, or did the local jurisdictions handle that?
The local jurisdictions handled that here in San Diego.
Okay. And then last question I have is on the list here, would a 3-sided canvas tent, sounds like a workaround here, would a 3-sided canvas tent set up with several tables of non-cohorts, where the 3 sides are closed, be considered outdoor?
No. So the guidance that we received was that you can only have 1 wall. So there could be an overhead, but 3 walls would be indoor.
Great. Very clear answer. Thank you. Okay. We're almost to the end of our time. Are there any final burning questions that anyone else has? If now, you need to send them through the Q&A. Otherwise, we're going to wrap up. Going. Heather, great job, great presentation. Thank you so much. I think what I would like to do, if you could let me share my screen, I want to remind people of the, let's see, come on. I want to remind people to do their evaluation. So in order to do your course evaluation, you click on the REHS course evaluation right here, walk through the steps to get your credit, your CEUs for this training. So our next training is going to be when? Everybody knows it's next Thursday, 9 a.m. And we look forward to seeing you all there. And with that, I think we're going to wrap it up. Thanks a lot, everyone. Have a great day. Take care. Bye.